Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the 196th episode of the Codecast podcast. My name is Terry Fletcher. I hope everyone had a good weekend and you are getting a lot of work done as a lot of new releases have been made by Medicare and also the official guidelines for ICD10 and also the ICD10CM file was released as far as what we're looking forward to in the next fiscal year. And remember, I-10, which are diagnoses, those become effective on October 1st through September 30th. So I wanted to talk about the 2022 ICD-10 official guidelines, not necessarily the codes, but the guidelines, because there are some new direction and new references that are very helpful in how to use some of the codes. So I wanted to give you just some of the small changes that are noteworthy that can help you, because I've noticed that when I talk to staff about guidelines, they're like, oh, well, we saw the new codes, but not everybody reads the guidelines on how to use the codes. It reminds me of somebody who opens up a map but then doesn't read the directions. So we want to make sure that we always read the directions. And you can always get the full guideline document at the CDC website. And you're looking for 2022 ICD10CM guidelines. So there is also a code release, but we want to make sure you know what the guidance is moving forward. So a couple of changes in the guideline number 13 has the guidance added. So this is about laterality. So it says when laterality, which is when you specify right or left in your diagnosis coding, and when it's not documented by the patient's provider, code assignment for the affected side may be based on medical record documentation from other clinicians. If there's conflicting medical record documentation regarding the affected side, the patient's attending provider should be queried for the clarification. Codes for unspecified sides should rarely be used, such as when the documentation in the record is sufficient to determine the affected side and it is not possible to obtain clarification. So this is actually a really good guidance. So basically, if your physician forgot, which let's make sure that they don't forget, because that's an important part of letting you know whether the problem was on the right or left side of the body. So I do a lot of peripheral or vascular, and when we're talking about that, we're talking about like lower extremities and renals and things like that. And laterality plays an effect on that. Also with orthopedic coding, if you're doing a meniscal repair on the knee, then you want to know right or left knee. So when your physician basically doesn't put it in the record, but let's say that you had an MRI report or a pathology report, so another clinical report that was in the chart, you're able to pull from that. And if it's not in the chart, then, or if it's conflicting, then you want to make sure you query your provider and make sure you are querying appropriately. If you ever want to know how to query, I wrote an article last year for ICD-10 Monitor, and you can click on the news piece on there, ICD10monitor.com, and then go to the advisory board and editorial board, really, and I'm part of that. And then you can click on anything I've written there. Just find my photo, find my name. And it tells you how to query. So we want to make sure we're not leading the physicians into anything. But I like that new change in the guidelines as far as making sure you can find laterality within the chart. Another revision occurs in guideline number 14. And whenever you're looking for changes, it's very similar to the CPT errata where they put it in bold. Okay, so for this one, they said documentation by clinicians other than the patient's provider. That's what the highlight is. Code assignment is based on the documentation by the patient's provider. So this is the one legally accountable for establishing the patient's diagnosis. It says there are a few exceptions when code assignment may be based on medical record documentation from clinicians who are not the patient's provider. Okay, so this is the person obviously not accountable or legally for establishing the diagnosis. So here's the addition. It says in this context, clinicians, and they quote it, other than the patient's provider, refer to healthcare professionals permitted based on regulatory or accreditation requirements or internal hospital policies to document in the patient's medical record, official medical record. These exceptions include codes for, now this is very specific, body mass index, depth of non-pressure chronic ulcers, pressure ulcer stage coma scale, NIH stroke scale, that's the NIHSS, social determinants of health, they're really trying to capture those. Laterality, which we mentioned before, and blood alcohol level. So it really goes on to say, it says this information is typically documented by other clinicians involved in the care. So you might have maybe a dietitian that documents the BMI. The nurses are the ones that are usually documenting pressure ulcers and what stage they are. A lot of times the EMT, the emergency medical technician, they're documenting the coma scale on a patient. And then associated diagnoses such as obesity, overweight, acute stroke, pressure ulcers, or conditions classifiable to the F10 category, which is alcohol-related disorders, they must be documented by the patient's provider. So they were very specific about that. If there is conflicting medical record documentation, either from the same clinician or different clinicians, then again, they direct you to query the main physician, the one that's legally responsible for that patient's clarification. They talk about the BMI, coma scale, NIHSS, the blood alcohol level, and the codes for social determinants of health should only be reported as secondary diagnoses if they are being reported by the non-physician, primary physician for that patient. So they talk about that as secondary, which makes sense. So if you have a different provider than the patient's provider that's making the main diagnosis, and there's other clinicians who are in the chart or involved in the patient's care, they're only going to be supplemental diagnoses or secondary diagnoses responsible for that. So that is actually a good new direction, where they're basically saying we need to have everything inclusive, and if we can find it in the record listed by other providers, other clinicians, then yes, that's appropriate. And they do say clinicians, so it can't be a biller, can't be a coder, can't be somebody who is not involved clinically with the patient. So make sure you also have that direction. Under guideline number 18, so that's the use of sign, symptom, and unspecified codes of the general coding guidelines, there was a new paragraph added to the guidance on this one. And it said, as stated in the introductory section of these official coding guidelines, a joint effort between the healthcare provider and the coder is essential to achieve complete and accurate documentation, code assignment, and reporting of diagnosis and procedures. The importance of consistent, complete documentation in the medical record cannot be overemphasized. Without such documentation, accurate coding cannot be achieved. The entire record should be reviewed to determine the specific reason for the encounter and the conditions treated. Okay, when I saw that, I was like, oh my gosh, we finally got a footnote in the guidelines for coding. So they said healthcare provider and coder. So I'm doing a happy dance on that one. So you finally get a footnote in the ICD-10 general guidelines as being recognized for the work that we do. And then within section IC for chapter specific guidelines, you will notice on that there's going to be a location, some additions in that chapter 1. That's infectious and parasitic diseases. They have things highlighted in bold where instead of RO 5.1 cough, now it's acute cough, or RO 5.9 cough unspecified. And they also added RO 6.02 shortness of breath and RO 6.9 fever unspecified. They also gave some post-COVID-19 guidance, which is very helpful, and I really like this. This is an IC.1.G1.M. So in M, it says post-COVID condition, post-COVID-19 condition, let me clarify. So for sequela of COVID-19 or associated symptoms or conditions that develop following a previous COVID-19 infection, assign the specific symptoms or condition related to the previous COVID-19 infection, if known, and code U09.9 post-COVID condition unspecified. Now remember, you still have to have a positive COVID test. It cannot be what they did the first 6 months of 2020 where they allowed a COVID-19 positive to be recorded even if the test was negative. So, and then they came out last August and said, wait, hold on, we're not letting you do that anymore, especially to get the 20% increased in reimbursement. So we want to see a positive test within 14 days of admission or a positive test within the practice to be able to confirm that's positive. It's all about statistics now, so we have to, luckily they went back on that. Then it says the U09.9, again, that's the post-COVID condition, should not be assigned for manifestations of an active or current infection. So this is you had the infection. So I'm thinking this would be something possibly for me because I had COVID in February 2020. And then the muscle aches still have not gone away, and we're now in, 17 months later. And so I wonder if that would be part of that. And then the third instruction says, if a patient has a condition associated with a previous COVID-19 infection and develops a new active current infection, the code U09.9 may be assigned in conjunction with the U07.1 to identify that the patient has a condition associated with a previous COVID-19 infection. And then they say, code the specific condition associated with that previous infection. So you also have to make sure narratively that you have differentiated that out. So it has to be specific within the record. And then it says, note that Chapter 22 does not contain the guideline for post-COVID-19 conditions, even though the code is referenced there. So then you have to make sure you go through all the COVID-19 guidelines very carefully. Also, make sure you read over the guideline revisions in Chapter 4 relating to diabetes and the use of insulin, oral hypoglycemics, and injectable non-insulin drugs, as well as Chapter 5 for mental, behavioral, and neurodevelopmental disorders regarding psychoactive substance abuse, unspecified, and medical conditions due to psychoactive substance abuse and use and dependence. Also, make sure you're looking at the social determinants of health. We had some new additions there, which I think are going to be very helpful. And remember what social determinants of health are. Those are basically health external disparities that affect the patient ability to get proper care. So let's say that they have a low income, or it's a certain ethnicity population that isn't getting, the health care they need, or it's a patient who can't financially afford their medication. Those kinds of things need to be included as a secondary diagnosis because it's really going to make a difference to support those higher levels of service. So it's imperative that you're looking at a lot of these guidelines because, first of all, your clinical documentation integrity just relies on it. But also, health information management is all about making sure that you're educating yourself, updating yourself, not just on the codes, but on the directions on how to use the codes. So the effective date for the fiscal year 2022 official guidelines is October 1st, 2021, and that's the same for the ICD10CM PCS, which is for the hospital. So just make sure that you're reading through that, just give you kind of a tidbit into that, and that should be helpful for you actually moving forward. So instead of a coding question today, I am going to give you a snapshot of the 2022 ICD-10 codes. So let's take a look, and it is just a snapshot so that you actually look at expanding those and make sure you look at all your new codes. So we ended up with 159 new codes, along with the new information in the tabular and the index. And then we just want to make sure you're aware that whenever they say deleted codes and invalid codes, a little bit different. A lot of times when they say new codes as well, it means that they may have taken a code that exists and added a fifth or sixth digit to it, even a seventh digit to it, just to give it a little bit more clarity, a little bit more detail and specificity. And deleted codes mean they've basically done away with the code. Revised codes, if you ever see that means that the actual descriptor of the code has been altered. Okay, so in infectious and parasitic diseases, we have one new code, and neoplasms, we have 3 new codes of note, and those are new codes for malignant bilateral ovaries as primary and secondary. We have in diseases of blood and blood-forming organs, we have 5 new codes in the D code section. Expansion of D75.83, thrombocytosis. And then in endocrine, we have 1 new code, and that is a Niemann-Pick disease in the E75 area. Mental, behavioral, and neurodevelopmental disorders. Chapter 5, that would be we have 3 new codes, that is in the F code series. Expansion of depression, and that's sad to me, but I'm sure it's because of the pandemic. And then nervous disease, we had an expansion of toxic encephalopathy. We have 10 new codes. And then in diseases of the circulatory system, Chapter 9, we have one new code. It's I5A for non-ischemic myocardial injury. In the diseases of the digestive system, Chapter 11, we have 13 new codes, and we also have a new subcategory for gastric intestinal metaplasia. In skin and subcutaneous tissue, Chapter 12, we have 8 new codes, and there's some new subcategories as well for irritant dermatitis. Musculoskeletal, so for all you ortho coders out there, you basically got hit the hardest. Chapter 13 got 23 new codes. So the expansion of SJOGREN syndrome at the M35, non-radiographic axial spondyloarthritis, M45, and low back pain got some new specificity. Isn't that helpful? We've had low back pain forever. Chapter 16, conditions originating in the perinatal period. We got 9 new codes for abnormal findings on that neonatal screening. Signs and symptoms, so Chapter 18, and clinical and abnormal clinical laboratory findings. Then we got 14 new codes. I mentioned the expansion of the cough, and then also feeding difficulties got some new codes. Injuries and poisonings, those are the S through the T codes. That's in Chapter 19. We actually did get 45 new, so I guess that was the T code section, and that's also where we get into some of the primary social determinants of health. Most of them are in the Z code section, but we did get 45 new codes in Chapter 19. The external causes codes, which are now V, W, X, and Y codes. Chapter 20, legal intervention. We got 3 new codes there. Factors influencing health status. So the social determinants of health got 19 new codes. Just a couple of them, just to give you a list. We have a less than high school diploma, inadequate drinking water supply, expansion of homelessness, a little bit more specifics there, lack of food, and then other problems related to housing and economic circumstance, which I'm thinking because of the pandemic and things that happen with people not being able to work and losing their homes and things like that, I'm sure that was part of that. And then we also had, now they have in Chapter 22, which they call it Codes for a Special Purpose, and that's where you find the post-COVID condition codes under U. So that was the one code. So, not all chapters have new codes, so we just want to make sure that you are taking a look at that. Again, you can find it at the CDC website because they have released the brand new codes for 2022, and they become effective October 1st. Okay, so my personal tidbit today, I actually found a new phone app that is actually a little bit dangerous. It's called Keepsake. So I don't know if anybody has ever seen it, but what it does is every time you take a photo off your phone, and you store it or whatever, if you wanted to frame it, you can go to Keepsake. It'll say start framing. You pick the photo off your phone, and then you can pick whatever frame you want. If you want to do a collage, you can pick up to 10, you can pick 10 or more photos, and basically it puts it together, and you get to pick from 40 different kinds of frames. It's crazy. It's very reasonable, and then they put it together for you, and then they ship it within 3 business days. How dangerous is that? I've been sending people all kinds of photos. Somebody just sent me a photo of themselves. Her and her husband were on their 10th wedding anniversary, and it was a really cute photo, and I knew she'd just keep the phone. How many times do we just keep photos in our phones? We never frame anymore. Back in the day, we used to take our film into Costco or Thrifties or something, and then we'd have these photos we get to frame, but we don't do that anymore. We keep it in our phone. And she got it in the mail today, and she was like, oh my gosh, I got a framed photo of Joe and I, and it was so great. So, I went to Napa recently, and I did a collage of a dozen photos and just picked the ones I wanted off my phone, and they framed them all, and I sent it to my daughter, and she's like, we have it for our wall. This is so cool. So anyway, again, it's called Keepsake, and it is a free app, but the framing is not free, but it's definitely a pretty good price if you're looking for any kind of gifts for people. It's amazing. So anyway, just a personal tidbit this week. I hope everyone appreciates the information today and you're getting up to date on your ICD-10. Now, one thing I did want to do is I wanted to be able to give you the PHE standing. It is actually about 3 o'clock on Friday that I'm recording this right now, and they still have not updated the PHE.gov site. So the PHE is supposed to end on Wednesday. If they don't update it, make sure you're looking Monday and Tuesday. And I'll also have it on my website at terryfletcher.net. But just make sure you're looking out for PHE.gov, because we have 3 more working days and then it's over, and all of the flexibilities under telehealth and everything would roll back if they don't extend it. I expect them to extend it, just so you know. I expect them to extend it about another 90 days. So anyway, everyone, make it a great day and a great week, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.